with Warrendale Wagyu. I'm Emma Buckby. I look after the marketing, communications and ESG side for Warrendale, and it's our absolute pleasure to be hosting this webinar today. We thought it'd be a really good opportunity for you to learn a little bit more about the health group that's being formed and kind of where we're at with that and where that might be going, but more importantly around the Mycoplasma Bovis project that is being rolled out, and you've probably seen some emails floating around for that. So we're really happy that you've joined us. We've got a fabulous panel of people. So we've got Phil Alcock, who is joining us from Bishopton Vets, who's very much one of our key advisors in this project. We've got Harriet Scott, who's from Raft Solutions, which is linked to Bishopton Vets as an operations director and project manager. And then we've got Tim Potter from Zoetis. And as you've probably seen in some of the information, Zoetis are key at leading this productivity rollout as well. So really exciting to have them on. But also we've got Jamie Brownrigg, the production director from Warrendale. So really looking forward to handing over to those in a few minutes. Just before we do, a few bits of housekeeping for you. Number one, we are recording this and you will get a link after the webinar. So you will be able to rewatch it, or if you can't make it at all, you can definitely see that again. Also, you should have a bit of functionality in terms of chat. That chat is open to everybody, but if you want to ask the panelists some questions directly, there is a speech bubble with a question mark in it. If you click on that, you should be able to ask questions. I believe we're probably going to save questions till the end. So you've got a presentation to start with from the panelists, and then we'll move on to questions. And we're very much looking forward to seeing what those questions are. I'm going to disappear now and hand it over to Jamie. Off you go, Jamie.
Okay, thank you, Em. Thanks for the introduction. To reiterate what Em said, thank you for everybody's attendance this evening. We've had strong interest, good registrations, so hopefully it'll be very worthwhile you tuning in. Just to give you a brief overview of how we've reached this point of our first webinar in conjunction with Bishopton and Zoetis. Over the past few months, we're as a company, Warrendale, are in the very early stages of creating a health strategy group, which is the Bishopton part. We recognise that we have a responsibility to ourselves as a company, our farmer partners, to improve things and try and increase productivity within the scheme. If we can review protocols on a regular basis, improve productivity with the animals that are within the scheme, reduce mortality, and also with that, probably hopefully reduce costs through prevention rather than cure. That leads us to tonight's topic, which again, as a scheme, we recognise it to be a challenge, not only within the scheme and not towards Wagyu in particular, but within the wider industry. We recognise that mycoplasma can cause significant problems if it's not dealt with correctly. So with that, we'll move on to the next, which is the presentation, I think, and I've said enough, and the questions will be coming at the end, I believe. Thank you.
Okay, well, thank you everyone for the introduction, and thank you, Jamie. So my role in my brief here is to give a brief introduction to Mycoplasma bovis and sort of start talking about some of the challenges. I think what we've found is that some people on this call will probably be very aware of this disease, others it may not have experienced it, and so we're just making sure that sort of everyone is coming from the same place in terms of knowledge about it. So we want to go through, introduce it, and then we'll start introducing some of the potential control measures, and then I'll hand over to Phil to expand about the sort of much more Warrendale specific approach. So if we can go on to the next slide, Harriet. So what are we talking about? So Mycoplasma bovis, it's a bacteria. It's a very small bacteria and is very specific. And I'm not going to spend a lot of time talking about the bacteria itself, but one of the key things to realize, it is different to other bacteria. It doesn't have a cell wall. And what that means is that actually there are a number of antibiotics that aren't going to be effective against it. Antibiotics target bacteria in different ways. So some of them act on the cell wall. So if we're dealing with a bacteria that doesn't have a cell wall, we're instantly presented with a bacteria that is going to be resistant to those antibiotics. So that's probably one of the key take-homes, is sort of making sure that actually when you're talking to your vets about treatment protocols and things like that, that you've got something specific for Mycoplasma built into that, and you're sort of recognizing that actually some of the antibiotics that you may use relatively regularly aren't going to be effective against it. It's generally found on a lot of the mucosal surfaces, so respiratory tract, and also in the sort of urogenital tract, the GI tract, and also the udder, and that sort of feeds into where we see this disease. It's first reported in sort of 1961 in the US, and then has spread sort of pretty much worldwide since then. As Jamie alluded to, and probably Phil will testify to, clinically we have started seeing more and more of this disease over the last 50, 60 years, and sort of it's gradually spread across the world. And actually probably in the last 10, 15 years in the UK, it's starting to be really come apparent and in all systems. So it's not just in calf rearing, we see it on dairy systems, and we also see it in finishing systems causing an issue. So it is something that people are becoming increasingly aware of, and can be damaging in terms of production, right, sort of increasing antimicrobial use on farm, but also that kind of health, welfare and sustainability. Most commonly, we see it as part of the respiratory disease complex. So if we go on to the next slide, please, Harriet. So as I said, worldwide, where we are at currently within the UK, we, Zoetis, have been sort of monitoring samples from farms for the last 7 years with regards to Mycoplasma, and this is bulk milk tank samples, but also blood samples. And what we're seeing is about 45% of the samples submitted through our scheme, so that's 45% of nearly 10,000 samples that have come through to us, are testing positive for Mycoplasma bovis. That probably represents, when we look at what the sort of sample makeup is, sort of actually 65% of the farms that we test through our schemes are coming back as positive. So real evidence there that there is a challenge with this disease, and it is endemic in the UK dairy herds and also on the beef units. And I think it's one of the key things that you'll see as part of this project is us understanding where it is within the system specific to this call. So if we go on to the next slide, please, Harriet. So what are the main signs? Most commonly, Mycoplasma sort of presents as being part of the sort of respiratory disease compared sort of complex. So we see signs of pneumonia. So you're not going to be able to visually look at that animal and distinguish it from other causes of pneumonia, but when we do investigations, we take samples, we find it as one of the pathogens that causes pneumonia. So your typical sort of coughing cough and things like that. One of the classic signs we see around the pneumonias, it's often these sort of very chronic cases. You can see in the sort of picture there, the lungs, if you look closely, you see those sort of really cheesy sort of caseous nodules in the lung. So those are sort of little micro abscesses. And you can imagine once those have been formed, they're very difficult to treat. And we sort of see these animals with sort of chronic recurrent pneumonias and sort of that sort of chronic wasting and sort of really unresponsive to a lot of treatments because of the sort of damage that's done to that tissue. So that's the sort of the classic presentation we see. And you can see on the graph, the green lines is the sort of, those are the numbers of cases that we see of sort of pneumonias. We also see Mycoplasma causing other diseases, so otitis, so ear infections. And so you may see calves scratching at their ears as it sort of then it becomes established and we see damage to the ear and the nerves associated with that. We then start seeing the sort of the classic sort of head tilts associated with the disease, or ear droops as well. So another sort of symptom that's probably a bit more specific to Mycoplasma, especially in your calves, it is worth looking out for. Less commonly, we also see arthritis, so swollen joints, lameness. And it can also cause mastitis, although sort of actually relatively infrequently diagnosed within the UK. There is a sort of occasional diagnosis of it, and probably it's potentially a bit underdiagnosed just because of the nature of the sort of the bug. It takes a lot of time to grow it in culture. So typical methodologies that we would normally do for bacteriology, we would normally get a result within 24, 48 hours if we're doing culture. For Mycoplasma, we need specific media to grow the bug in, but we also then need to leave it for probably closer to 5 to 7 days. And so often there is a potential that we are underdiagnosing it on some dairy farms. If we go on to the next slide, please, Harriet. So what's going on the farm and how does this disease spread? What we find is that ultimately the calves are picking it up from their mums. So they're pretty much, the cows are going to be carriers, and they may well be asymptomatic about it. It's like a lot of other bacteria. That cow may well be carrying it, not actually showing any signs. So the classic sort of pattern we see is that that calf picks it up from its mother, sort of when it's with her in the calving pen. So that's sort of an initial 24 hours, and that's going to be via vaginal secretion. So through the calving process, through colostrum, through her milk, or through nasal secretions through the direct contact. We're then in that position where we've got a calf that it is sort of has been exposed to mycoplasma. And we then have that sort of scenarios that can then happen. So we could have that calf goes down with the disease, and so there's then persistently sort of, you see that sort of coughing, we then see the sort of disease associated with it. We may see that animal then recover and sort of clear mycoplasma completely, or it may recover and then still just potentially just carry it and then act as a potential shedder. And then what that calf will then do is we move it into a group house situation, as you know, or it moves onto a different farm where it's exposed to different circumstances and mixed with other animals. We then see potential for a sort of extensive spread between the calves. So moving from one animal to another and sort of through a pen. So what we end up in that situation is that actually the disease can spread very rapidly within the group situation. And then we sort of see the sort of classic outbreaks or sort of larger number of cases that people often experience. If we then go on to the next slide, please, Harriet. As alluded to previously, like any disease, treatment and accurate treatment is going to be really important. It's going to be really important that we accurately identify the disease, and I think this is one of the key things we're encouraging everyone to do, is ultimately chat to your vets, make sure your entire team are happy identifying this disease and that you've got appropriate treatment protocols in place, because the longer the disease goes on untreated, you can imagine those nodules form more, and actually that long-term damage to the lungs that actually is going to have a massive impact on the sort of the growth rate of that calf going forward, even if it does recover from the disease. So the sooner we can get the appropriate treatment in, the better. And so making sure you have a correct treatment protocols in place is going to be key for your management of this disease. And so that rapid identification of respiratory disease, accurate treatment is going to be really important. Next slide, please, Harriet. So how can we manage it? And I think if we sort of break it down into sort of key areas and sort of key points, I think probably what we'd encourage is everyone have an understanding of the disease risk for your farm. So understanding your status, and we can help that through testing to sort of understand your status as of now. So a snapshot appearance, and sort of that gives you an idea of whether there is evidence of exposure on the farm, but this disease spreads very easily. So I think there's always going to be a risk, especially if people buying in and moving animals around. So it's always being aware of it, but knowing your status is important. I think, as we've alluded to, making sure you effectively manage those clinical cases. If we do have an outbreak or we do see cases, the sooner those animals are treated, the less likely it's going to spread from one calf to another. And so us breaking that cycle and breaking that spread is going to be really important. And alongside that, we need to think about how we can reduce transmission. So thinking about how can we reduce the transmission from the cow to the calf, from the calf to the calf, and then also that potential spread through the environment. And the other thing we need to do is that we're never going to be able to eliminate this sort of the bug from the sort of the system. We're always going to see there at a risk. And what we also want to do is maximize the immunity of the calf so it is best positioned to be able to fight off the disease in the first place, and so we don't see a problem. We go to the next slide. So if we think about maximizing immunity, and this is not going to be specific to Mycoplasma, key thing is how are we going to get that calf in a position that it can protect itself? So what are we doing to give it that suit of armor that sort of is giving it the best possible start? And like any disease for calves, colostrum quality is going to be really, really important. So making sure that for the dairy farmers on the call, we're reviewing and monitoring colostrum feeding. We're getting that right. We're getting the amount of colostrum these calves need so to really give them that immunity in the first place. But moving forward, what you then need to think about is that actually the immune system is reliant on nutrition to be able to act effectively. If the calf is not getting enough nutrition, it's going to be not able to sort of make use of its immune system effectively, and it's still going to succumb to the disease. And similarly, if we put it into a poor environment where it's going to be exposed to a high level of challenge, or the animal is going to be stressed, actually that we see that potential for disease happening. So good environment, minimizing the stress, and Mycoplasma, as I say, is part of the pneumonia complex. So it is really important that we then think about how do we sort of fit managing Mycoplasma alongside management of the other viral diseases and viral causes of pneumonia. So we're not saying that actually it's an either-or system. It's basically this is a sort of bolt-on as how do we look at controlling Mycoplasma in your herds and in your groups on top of what you're already doing to control the other respiratory pathogens. And we do have the opportunity to vaccinate it out against M. bovis. Harriet, we can go on. So last couple of slides from me, and I think what I want to do is just introduce the new vaccine option that we've just brought to the market within the last year, product called Protivity. So this is a vaccine for Mycoplasma bovis. It's a live vaccine. It can be used in calves from 1 week of age. So what we're seeing is it offers that real good opportunity to provide cover to calves through that stressful period, as you alluded to. It's when they're moving around, and so that they're going into those mixed situations, that early onset of immunity is going to be important for us to sort of prevent the establishment of the disease within those groups. So it's a 2-dose program with the 2 doses given 21 days apart, and then we get the immunity pretty much from 12 days after that completion. And we've got studies now to sort of show that the product is very effective in challenge studies, and sort of actually has brought some real benefits to people that are using it. If we go on to the next slide, please, Harriet. So what we're seeing, and people using it from 7 days of age, starting on that 2-dose program, we get that sort of protection from 6 weeks of age sort of across the group. And we're then seeing reduction in clinical signs. So animals are returning to feed much quicker. We have less issues with pyrexia, so the temperature doesn't go on as long. We're also seeing significant reduction in the lung lesions. So that long-term damage that we see in clinical cases is really reduced. So we see a 75% reduction in the lung lesions in calves that are being treated with Protivity versus animals that haven't had it when faced with Mycoplasma challenge. We go on to the next slide, please, Harriet. So it's like any other vaccine. If you're using it, speak to your vet, think about how best to use it on your farm and how to sort of fit it in alongside other vaccine programs. It is a live vaccine. So the one thing that we have to be really careful about is the use of antibiotics at the same time as the vaccine. So when you're speaking to your vets about it, make sure that they go through with you the sort of the precautions you need to take about when you can use antibiotics or which antibiotics you can use alongside this vaccine, because if we give antibiotics at the same time, we can actually effectively kill the vaccine, and then you limit the response that you're going to get from it. So it is making sure that you're thinking about the risk for the period that you're vaccinating for and working with your vets on that sort of clinical approach. Next slide, please. So in summary from me, I think what we're doing, and sort of the partnership that we're working with sort of Bishopton and Warrendale, is sort of looking at sort of how Protivity and sort of Mycoplasma vaccine can sit alongside other health protocols within the system. But it's there as a tool. So it is thinking about how you also can control the spread of the disease, and sort of speaking to your vets about identifying mycoplasma, treating it properly, but also other management controls. The vaccine itself is 2 doses given 21 days apart. And what we've shown, and sort of I think one of the appeals for it within and why it's being considered, is so we're seeing that big reduction in lung lesions. We see reduction in clinical signs of mycoplasma. And because of that, what we've seen in field studies and sort of systems is actually we're seeing significant reduction in antibiotic use, which is a very important key factor within the industry as we move forward. And we are seeing improved average daily live weight gain of 100 grams per day compared to non-vaccinated animals. So I will wrap up there. I will then hand over to Phil, and I think Phil is going to speak in more detail about the approach to M. bovis going forward within the supply chain.
Thank you, Tim. Yeah, thanks for that whistle-stop tour of mycoplasma, really useful. And as Tim says, I'm going to talk about the so what here in terms of what are Warrendale going to try to do to impact on this disease. It's certainly come to Warrendale Wagyu's attention that mycoplasma as a problem is a growing problem. A lot of producers are feeding back some difficult scenarios associated with mycoplasma, and the production team as well giving us a lot of feedback about some of the challenges that they're facing. So with the launch of a new vaccine, a fresh opportunity has presented itself in many ways. And there was certainly a desire to include that in the kind of Warrendale approach to vaccination. But we wanted to do better than just passively say, go ahead, everybody, and vaccinate. So we've put together something of a project which we hope will do a better job than that in hopefully working together towards a good result. So we'll go into that a little bit now. So Harry, if you could move along, that'd be good. And quickly to let you know who's involved. So as Jamie alluded to, my name's Phil Alcock. I'm one of the cattle vets at Bishopton Veterinary Group in North Yorkshire, and we're providing technical support and health advice at a kind of Warrendale Wagyu level. We see that relationship as being supportive of kind of guiding the approach that we take together collaboratively, and we see the role of your local vets who know your farm and your system and have working relationships with you as fundamental to our success. So this project very much has your vets in mind just as much as your producers. We have the benefit at our practice of a sister R&D and project management company in Raft Solutions. So my colleague Harriet's here, who's helping us organise this project as we go forward as well. So onto the project. So we thought we'd do a few things. Although it's clearly a significant problem for us as a group in Warrendale, most of our feedback is subjective, and pieces of clear diagnostic information are mixed in there, but there's an awful lot of anecdote in there too. So we're offering a snapshot surveillance prevalence aspect to this project. And we'll go on to talk about that in a little bit more detail shortly, but essentially it's a supported, funded way for us to take a snapshot across the group at just how widespread mycoplasma appears to be. We're going to vaccinate for Protivity wherever possible, and we're hoping to ensure that our producers in Warrendale are working closely with their vets to implement that really effectively and most suitably for the farm, and occasionally not to implement it if it's the wrong thing to do. And we want to really encourage everybody to get onto early reporting, both so we get some great feedback on what's working and what's not, but also because, as Tim alluded to in his section, mycoplasma is a difficult disease because, unlike some of our, let's call them more traditional pneumonia pathogens, it kind of sneaks up on you, in my experience. It often grumbles away and you know something's not quite right, but it's not clear what until the disease is quite established, compared to, say, a traditional let's say, Pasteurella type of pneumonia, where actually animals go from fine to very poorly very quickly, and it can be a slightly different kettle of fish. So we're looking to really raise the bar in terms of early detection and prompt treatment in the project as well. And as we've alluded to already, Warrendale Wagyu have driven the launch of this and are supporting this in a number of ways. Harriet through Raft are providing the organised part. Zoetis technically supporting their vaccine and the vets and yourselves in the field. And of course, you know, the producers and your vets being fundamental to making this happen. On to our next slide. So in terms of what we're providing, there's a prevalence test provided for free. So we'd like all dairy producers please to take a bulk milk to give us a snapshot of how widespread that is. And as in the slide that Tim presented earlier, it's so widespread, to be honest, we're expecting most dairy farms to show some evidence of this. So there's certainly no stigma and nothing unusual to finding this disease on your farms. Hopefully, if it's not something you've thought of, it will be a useful thing to you to consider with your vet and to talk around as well if you're a dairy producer. And in the case of calf rearers, we're offering 5 blood samples to the same effect. Now, recognizing this is not a complete assessment, it's a snapshot. A negative set of results could just mean we've picked the wrong batch of calves, or things may come and go over time, but it's a start and it's going to give us something objective to look back at towards the end of the project. In addition to that, we're providing enhanced support through Zoetis for anything that's not going well. So there's always support available. Zoetis and other pharmaceutical companies will always support their products if unexpected outcomes and disappointing outcomes occur. So in terms of potentially supporting the diagnostic approach and sometimes providing funding for that, that's always available. But as part of this project, we've also got a dedicated point of contact in Tim, that's Tim Potter, and Tim is going to be in a state of readiness for all Warrendale inquiries, so that we're aiming to essentially fast track and support very quickly those kind of inquiries. So we're very confident that we're going to have some really useful enhanced diagnostic support that we can deploy really early in a problem rather than waiting until perhaps a problem's become, you know, really serious. So really encouraging all producers to speak to their vets at the first sign of trouble. Once we've started using Protivity, the first problems you've got, please log that with Zoetis, and you can expect a really positive response and lots of support as appropriate. Next slide, Harriet. So we've sent out an information pack already, so that should give you, or you should hopefully have all received this, or producers should have received this. So it gives you some background to what we've been talking about today about the rationale for our project and what we're going to be doing. There's also some quite specific what you need to do sheets in there for dairy and calf producers. And then we've got an information sheet for you to pass to your vets as well. Warrendale are also asking you all to please share with us who your vets are. Hope you're happy to do that. Hopefully it joins us all together even more effectively. And we can share information directly with your vets as well, kind of as appropriate over time. You'll also receive in that pack the specific lab forms that you need to go with your samples, but hopefully that's all self-explanatory, and some further information about Protivity. So we trust you've all received that. Next slide, Harriet. So just to review exactly what we're going to do. Step 1, you receive the info pack, hopefully you have. Step 2, please contact your vet and advise them of the project and of Warrendale's request that we start vaccinating with Protivity. Ask them for their support to implement that appropriately and to give you the necessary advice to make that a success on your farm. And as I've already mentioned, you know, it is very much for them to work that out with you. And if indeed it's not an appropriate thing for your farm, please just give some feedback on that to your Warrendale field member, and that's fine. Submit the bulk milk sample in the case of dairies, please, with the submission form. You can send that with your vet. It's probably the best way to do that. And then start vaccinating, please. And as Tim's described, we're looking for dairy producers, please, to give a first dose of Protivity from 7 days of age. And obviously, most disease problems, tend to happen down the chain in terms of pneumonia and so forth. But dairy producers too, please, should you experience anything that's not good, the support will be there to help look into that with you and your vets. So on to calf rearers, Harriet. It's a very similar slide. Same pack has been sent out. Again, asking your vet to support you in terms of taking some blood samples, using the appropriate form, and then we're looking for you to work out with your vet timing the second dose of Protivity so that protection's in there nice and early. By getting in early, and this is our opportunity to work together, we hope to have a bigger impact, because protection can be in place earlier, but also that first dose alone does have some protective benefits in terms of cell-mediated immunity. So we hope that calves arriving on calf rearers are experiencing some protection even at that stage, albeit it's incomplete. And again, the first sign of trouble, please report that early, both to your vet, and they're very much the first port of call, but also there's a dedicated email provided in the pack. We'd love to hear feedback and problems on that email as well, both from your vets or from yourselves. And Tim will be in a good position then to assess those and see what sort of support is required. So we're off and running. August 25, we sent out the communications, and we'd love to see these samples being taken, please, from now on, and for vaccination to essentially begin as appropriate. Hoping there's going to be lots of good conversations with your vets this autumn about general pneumonia prevention, not just mycoplasma. And we hope that by maybe that bit of extra focus in combination with this vaccine, we can start to gain some benefits. I think it's really, really important that we recognise that, as Tim was showing us some figures before, it's a very widespread disease, mycoplasma. Other surveys have been done looking specifically at disease investigation. And I think one of the biggest studies that was done, and I think it's alluded to in your pack, roughly a third of disease investigations around pneumonia came back with mycoplasmal involvement. So it reminds us it's a very, very significant part of our challenges overall from a kind of UK perspective. But it's also really important to remember that does mean that 2/3 of pneumonia outbreaks probably didn't have anything to do with mycoplasma. So we mustn't overemphasize this disease, important as it is. We're going to go along throughout the year, gathering feedback and to some degree, therefore, assessing success and the rate of problems that we've had. And then come the spring, we'll be pulling together all this information from the disease surveillance snapshot, also from the feedback that we've had and our experiences. We're going to pull all that together, and we're going to present that back to you all at the Warrendale Wagyu conference in the spring. So that's what we're intending to do. Hopefully you agree we're trying to do a little bit more than just tell everybody to vaccinate, and as a result we can hopefully get a good collaborative effort to making a bit of impact on Mycoplasma bovis alongside other causes of pneumonia. So thank you, Jamie. That probably nearly concludes our presentation. I don't know if you've any kind of closing comments around it all before we go to questions. That I don't know if we've had any questions yet, or if any will start to come in.
Yeah, thank you, Phil and Tim. In the time that we've had, you've pretty much nailed what we wanted to there. I could probably start with a question, Phil, from a farming point of view, and trying to think about what they may ask, and that is there any risk for vaccinated animals being mixed with non-vaccinated animals, or is it quite a contentious kind of answer? That
well, Tim, do you want to go for that, with it being a very vaccine specific question?
No, yeah, so there shouldn't be any risk associated with the sort of mixing of that. So we're not looking at the sort of ultimately, if you start vaccinating the animals, that there's any risk of the disease spreading to others. I think it's sort of like anything, we are looking at herd immunity. So there is an aspect where actually the more animals that if you're not mixing animals in the same environment and things like that, there is you're going to get better results anyway. So there is that kind of like, if we're managing these animals separately and they're vaccinated, that's going to be the best possible thing. But actually, in a sort of mixed situation, there's no risk of disease spread, but it's sort of potentially you don't necessarily see as much benefit because there's always going to be that challenge potentially from the unvaccinated animals.
Thank you. Thank you.
Thanks, Jamie. So I see that our team in the background are kind of looking at some of the questions coming in on the chat and attempting to assign them to myself or Tim. So we'll have a go at answering some of those, I guess. So I've been given a good one to start off, and it's asking, is it not possible to vaccinate the dairy cows and therefore prevent the spread to calves in the first place and to give them some immunity from day one? Thank you. And that is a great question. Now, let's see how to answer it. I've got to put a bit of a sensible, almost disclaimer ahead of anything we go on to say, which is when it gets down to farm-specific advice, it's absolutely a question for you and your vet who knows your farm and the system and will be ultimately responsible for all that. I think I can say, you know, in terms of a general concept, that this kind of approach has been taken off license with other vaccines, and it is a possible road of inquiry. Productivity is certainly not licensed to be used in that way, and it'd be interesting to see if that also, you know, becomes part of a off-licensed approach that your vet might explore with you. For this project, with it being off-license and with the longer run immunity benefit to the calves throughout the rest of the rearing process that we really need to see that injection into the calf as well. But under certain circumstances, it'll be very interesting to see if what is described there does become part of control into the future.
And Phil, if you don't mind me jumping in on that situation, I think one of the challenges with Mycoplasma is the nature of the immunity that you need to protect against it, because actually one of the challenges with the approach where you are giving to mum is that we all know the colostrum brings across the antibodies, and antibodies are useful for a lot of diseases. The challenge we have with Mycoplasma is once it's in the calf, actually what ends up it gets into the cells, so it's an intracellular pathogen, and so actually the antibody response is less important. And I think so the nice thing about a live vaccine, which this is what we're talking about here with Pativity, is that it brings about a different type of immunity, which actually is going to be a lot more effective against that intracellular pathogen. And so we've seen that in terms of sort of actually the likelihood of it being much more protective for the calves going forward.
Thank you, Tim.
So one for Tim that I've been asked, and I can answer my part of it, Tim, and it's probably from a manufacturer's point of view, and like any vaccine, they come in particular sized dose batches. In this case, I've been asked around the 10 dose bottle. If a farmer has 5 calves ready, does he throw 5 doses away? Or my answer would be that, you know, this isn't only from a Warrendale Wagyu perspective. If Mycoplasma is recognized on the farm has been present, that they would also see the importance to use up the other 5 doses, not just on Warrendale Wagyu calves, but, you know, heifer retention, you know, ones that are going back into the herd. That is my answer, but my question is around the doses. Would there be, you know, is there any foresight to reducing the amount of doses in a pack to make it more amenable?
Yeah, and so Jamie, your answer is totally correct, and I think it's important that we look at other ways of sort of making sure that we're not adding undue cost and sort of or undue wastage within the system. One of the things in terms of the feedback that we're looking for from this is capturing things like this. So unfortunately, when it comes to vaccines and any medicines, there's quite a lot of process that goes on in terms of the pack sizes that comes through. So actually, when a medicine comes to market, actually we're only allowed to bring it into the size vials that we've done all the testing for. So it's not just a case of us instantly switching on a smaller pack size or anything like that, but we're always keen to hear feedback. And I think, as Phil alluded to with regards to sort of what we're keen to capture from it, is this is a new product in the market. If people feel that actually there is an opportunity there for or there are challenges around the pack size, that's useful for us to capture, because one part of my role is constantly feeding back to our pipeline and going, right, what do we actually want and what's going to be useful for the market. So if people do feel that that's a challenge, please let us know. We unfortunately can't do anything about it now, and that product does need to be used as soon as you sort of within that day of opening it. But if we get feedback from the rearers and farmers that actually they would prefer to have a smaller pack size, we can start feeding that back. It's not going to be a quick process to get it, but at least that feedback and that process is in place.
Thanks, guys. So I've got another question in the chat which has been assigned to me, but I'm going to read it to you, Tim. I'm going to let you have first stab at it, and then I'll chuck my 2 pence in potentially after that. So question is, the data sheet talks about not using antimicrobials until 15 days after the second vaccination. By this stage, the calf will be 6 or 7 weeks old. In what we're proposing, it may not be quite as old as that, but the point, I think, is the same. In the meantime, if the calf had fallen ill with a problem requiring antibiotic treatment, then the only products available to treat that calf would be those which were not harmful to the vaccine. In our experience, the antibiotic products that have no action against M. bovis and other pneumonia-type illnesses have not been as successful in aiding calf recovery as the antimicrobial products that do. So what is our experience of this, Tim or Phil?
Yeah, so it's a really good. This is a question to speak to your vets about, and that's not me passing the buck, because ultimately we don't know the individual circumstances on your farm. As I say, a lot of this is about getting treatment in the animal, and I think however we approach this, the one thing that he sort of, if you read through, is that ultimately we wouldn't want to withhold treatment from an animal that it needs it and it's going to be appropriate for it. So actually the sort of that the 15 days is sort of that sort of it's a very long period, and it's a sort of that's to give the best possible opportunity to vaccine to take. And it's also a lot of, if you read through, it's a lot of it's about the avoidance of sort of batch treating the whole group of animals and things like that. But your vet will be able to advise you, and the advice should be that ultimately, if the animal needs treatment, that the best way forward is that it gets the appropriate treatment at that, and then because we've vaccinated other animals around it, we should see at least some benefit anyway. But that I would be pointing you to have a conversation with your vet about choosing the most appropriate way forward. But Phil, happy for you to take a different approach.
Yeah, no, it's not going to be wildly different, certainly not in this format, Tim. But I would say, yeah, just good to acknowledge that although the point is well made that not all antibiotics are effective against mycoplasma, most of the ones you would reach for in a pneumonia situation are, to one degree or another. So the point, the problem raised is 100%. Tim's quite right. The individual animals, I'd be completely saying, treat those animals. Don't worry about that. That's 100% the priority. Their immunity will be being stimulated in a number of ways against mycoplasma and so forth anyway in that situation. So the longer run for that animal is a moot point. So the priority is the welfare of those animals in that situation. And if it got to a bad situation where a lot of treatment needed to be given, then sure, your vet's going to help you navigate that. But it could undermine vaccine efficacy if we were very unlucky with that. So yeah, definitely an individual farm and individual vet circumstances, but the point is well made, and it is an unfortunate scenario that could arise.
So go on, sorry, Harriet.
Sorry, I was going to say I've got one that I'll direct to you, Phil, and Tim might want to add to it. But What happens if I'm unsure if or when the first dose has been given? Do I give the second dose on based on best guess, or do I wait and restart the course?
Super question. So there is a calf declaration form that Warrendale producers are asked to complete, and that's just being refreshed at the moment, but I don't think it's going to change radically. So we're asking for all vaccines given to be recorded on that sheet, and that should accompany the calves onto their new destination. So I think if you've got that sheet, you should have dates, you should be able to work on it, and I think hopefully this project will help us tie that together a little better than, or even more consistently than it is now, because if you don't receive that sheet, which you need to do this, please let your production team member from Warrendale know that you haven't got it and you need it, and get to the bottom of it. If things really did get in a muddle, then I think we'd be looking to restart, or make a sensible guess, depending on the circumstances that you found yourself in. And again, a vet specific question would be, it doesn't have to be 3 weeks to the day, obviously, but again, there isn't a specific piece of guidance I think that's appropriate for me to give on that. Conversation with your vet and your circumstances as to how much wriggle room you might put around that 3 week window. It's a conversation to have with them as well.
So I've got a couple of questions. One based around the cost of the vaccine, which I'm going to completely pass the buck, because I don't want individual vets chasing me down the road saying that you said it was going to be such and such. It isn't far out of line with other pneumonia vaccines, and that's what we've based it on within the scheme. But we would hope that the cost of the vaccine wouldn't be the first thought. We would encourage people to think more about reducing mortality. If we can reduce one death, reduction in antibiotics, how that would be implemented into the cost and cost recovery. Second part of the question was, is the project mandatory? And would Warrendale be willing to support the cost of this? If mycoplasma is present within the dairies or within the calf rearers, we would hope that we wouldn't have to use the word mandatory, that it would just be done. Other cases, if people have any real objections to doing it, or they would certainly approach me or raise their concerns with the Warrendale representative. An example I can think of is if it was a closed shop from calves right through to the end. That might be something we can consider where there is no problem, but ultimately the way we've approached this project is for it to be anything other than us dictating as a scheme that you must do this. The whole advice, raising awareness of mycoplasma, the cost to people as a business, we would hope they would choose the right decision, which would be to vaccinate if it's present. But again, farm by farm basis. Are Warrendale looking to support the cost? We believe we are within the pricing structure that that we're putting together. Again, how is cost accounted for? Is that animals that go into a unit, more success with them leaving the unit? Is that more slaughter premiums being paid to the dairy farmer because his animals have made it through to the end? So again, Warrendale recognises there is a cost, and it will be accounted for as we normally do in anything we asked to be done in the scheme. Thank you.
I think there was one question in the chat that was for me about blood testing and which animals to test. I think with regard blood testing calves, speak to your vets and they'll be able to advise which ones are best suited to the diagnostics. Ultimately, a lot of what we're doing here with the serology and taking it we're just assessing whether the mycoplasma animals have been exposed to it. So there isn't a necessity to test unwell animals, and hopefully we're in a situation where we are just testing groups of animals just to see whether there has been challenges previously and there's pathogens circulating from it, because the blood test is reliant on an antibody response to it. So actually an acutely unwell animal may not have very high titers to Mycoplasma bovis. So we are probably just looking at testing the healthy animals. If you've got diseased animals, your vets may actually recommend that there are other modes of testing, so swabs and things like that, that may be more appropriate for investigation of disease outbreaks.
And just to add on a question to that, Tim, about sampling, does it matter if they vaccinate and then take the sample for the lab testing that we're requesting, or does the does the sampling need to be done before they vaccinate?
So ideally, we take the samples prior to vaccination. So.
Tim, could you just give the stages at which the vaccination would take place again, please? Just somebody that was late on has raised it in a question. At what point will we give the vaccinations? Either Phil or Tim, please.
Bill, do you want to go through what you envisage the programme to be?
Sorry, guys, could you say that again? We're getting a real flood of questions, and then I was trying to catch up by reading them. I missed that one.
Sorry, it was just that somebody that was late to the webinar has asked me at what stage are we giving these vaccinations, please?
Okay, sure. So we're asking dairy producers to, well, first and foremost is we're asking you to talk to your vet about it and work out what will work within your specific system. All we would like to see is the calves protected with productivity and a good proactive conversation to be had with your vet in all circumstances. But what we're hoping for is the first shot to happen on the dairy from 7 days of age, and then the second dose to happen around 3 weeks later at the calf rearers.
Thank you.
In your packs that you've had, the updated kind of Warrendale vaccine guidance already included some viral protection with an intranasal vaccine and, for want of a better word, a kind of conventional injectable pneumonia vaccine. So in your pack explains roughly how that all fits together, but then how you ultimately implement that is definitely a farm-specific question with your own vet. And as we've alluded to, sometimes it really won't be possible or appropriate. And that's again why we're looking to your vet just to make the right decisions for you, with you guys. This is the kind of the default. This is what we'd like to see happen in most normal situations. So we've got a bunch of questions here. As a calf rearer, what is the best age to test? I think, Tim, you've kind of covered that, haven't you, a moment ago with the with your comments on testing.
Yeah, and I think probably it's realistically, we will probably once you're full, if you're thinking about going in and doing, like, it may well be that you've got a batch of calves on now that you go in and just get those tested prior to starting any pativity. So I think it's just speaking to your vets and just making use of it. Likelihood is we're more likely to see a little bit of spread in it. So actually, if you've got multiple calves coming into a unit, if we test them immediately after they arrive, it's then a little bit potluck as to whether you get the ones that have seen it previously versus actually if they've been on unit for a couple of weeks, you're more likely to pick it up because actually it will give chance for the disease to sort of at least spread and other animals to be exposed to it. So I wouldn't necessarily be testing everything immediately. It's giving a little bit of time for the animals to settle in.
Okay, I've got some more. I'll try and get through them in the time we've got. So if the bulk milk sample comes back negative, is it still worth vaccinating is a question. So I would say the answer to that is, for the dairy producers, you are doing a lot of this really on behalf of the rest of the chain. It's fair to say. I think if you get a positive result and mycoplasma isn't particularly in your mind, then that's just an interesting thing just to check you're happy with your position and your plans on that with your vet. If it comes back negative, it doesn't guarantee you're going to be clear of the disease, I think is the first thing to say. So don't be too complacent in such an event. But also, many of these naive calves, if your dairy doesn't have it, are going to be mixed potentially at the next stage of their life with calves that have got mycoplasma. So in some ways, they're the calves that may need it more than any others. So yes, please do. We are looking for people to protect the calves, irrespective of the dairy status. Moving on to giving a booster, I guess that's the question saying, do you need to give a booster in general? So in terms of just reiterating, it's a 2-shot vaccine for the primary course. So hopefully that's been clear from 7 days and then approximately 3 weeks later. There isn't a specific piece of guidance yet around boosting, and it's not part of our project per se, but in circumstances where we have issues with mycoplasma presenting themselves that are known to you already as producers, or that yourselves or the production team highlight to us during the project, then there could be a benefit from providing boosters further down the chain. Tim, it's a specific vaccine point. I'll let you come in. I mean, there is some knowledge on the duration of immunity, and we can perhaps extrapolate a little on boosting, can we? Or are we getting too specific there?
Yeah, I would probably suspect we're getting a little bit too specific there, because I think a lot of it will be down to the individual challenge on the farm. The focus of this project is very much about that provision of protection to the calves. I think if we look at where the severe risk period for a lot of these calves is that sort of point at which they're being mixed. We see a lot of spread of mycoplasma on feeding systems, so especially sort of milk feeders, milk machines and things like that, because of the sort of, it's in the oral cavities and it's just spread that way. So the focus is very much about how do we maximize the immunity for these calves in the early stages of their lives. And then as we move forward with the project, I think it will then be a case-by-case basis if we feel the need that there is an opportunity to boost it, but it would have to be on an individual farm basis or in response to specific challenges on individual units. So I think at the moment we're certainly not looking at there being any kind of any boostering after those 2 doses. You're muted, Phil.
Doing so well, wasn't I, avoiding that one? But anyway, at the end. So here's the question. It sounds like the producer will do the dairy will do the first injection and the calf rearer the second. If so, where will blood testing come into this for the rearer? Because of course there's the potential to confound the testing, therefore. So that's really why we would like you guys to be getting the calf rearers among you to be getting on with your testing if you're going to take part, which we'd really appreciate if you did, soonish. There's obviously going to be a bit of a lag of quite a few weeks now until the antibodies are going to be produced from the vaccine that's being deployed, that would be potentially detected by the blood testing downstream anyway. So we've got a nice period of grace in the early phase of this project where that shouldn't be an issue for you.
And I think, Phil, I think it's almost, when we're looking at that testing, this is very much looking about existing sort of, we're looking at a snapshot. So don't view it as calves coming in from now on. It could well be that actually you blood sample calves that are already on your unit and slightly older calves, and actually that will give you a good indication of what's going on and sort of the challenges that we see. We're not looking at the sampling driving the individual vaccination discussions would be how I'd look at it. It's much more about sort of getting that snapshot. So don't be afraid of sampling calves that have been on your unit for a while already.
Thanks, Tim. So we really are at the end of our time now. So just to acknowledge any further questions that come in now, we will come back to you directly wherever we have those contacts and can do so. Please feel free to get in touch on the contact information you've had with the project as well. And yeah, we hope that you'll get stuck into this project with us and have some great conversations with your vets and hopefully derive some benefit from tackling mycoplasma directly. So thank you very much for your time, everybody.
Yeah, thank you.